fear is a big one with people because they don't know what they're seeing and they don't know what dying looks like. And so here, to ease this fear and anxiety, you do it with knowledge. And one of the things is, first of all, your patient or your loved one rather is non-responsive, and their breathing changes. It becomes very shallow and irregular, and you might see it very rapid at some point where the chest is rising and falling and you get really concerned. The other thing that takes place sometimes is there's long periods between breaths. Person will take a breath and then up to 45 seconds, you won't see another one. You may hear physicians say, well, that's Jane Stokes. But all you know is that they weren't breathing for a certain period of time, but that is normal in the process of dying. And their mouth open is always a difficult thing to watch. You walk in the room and their mouth is wide open, they're dry. So good oral care would be called for here. And they may appear like they're gasping for air. But again, this is the normal process. And you can hear congestion, a rattle, and sometimes you'll hear this word death rattle. And you know, the lungs will fill up with fluid, the back of the throat. They can't clear their throat. And so they get this rattle. And Maureen, I know you've seen this many times as an oncology nurse. And their pulse is weak. These are all things that just kind of can get you very worried if you're not prepared. And their eyes may be partially open, and they may moan or mumble. And you do have to be careful with this, and we'll talk about pain, but you want to make sure that pain is not connected to this or any kind of discomfort. And agitation, by the way, is normal. There's something called terminal restlessness, and under that comes agitation. So those are some of the predictable signs that you'll see over time, and you won't hopefully be as anxious, and you can stay calm throughout.